This year, the American Diabetes Association's National Health Disparities Committee is really proud to showcase and highlight 10 abstracts. And all of the abstracts focus on health disparities and were selected because they met certain search criteria and were reviewed by our committee in terms of being able to make a meaningful contribution to our understanding of health disparities in diabetes and also approaches to addressing health disparities. So we had a number of abstracts that focused on food insecurity, allowing us to better understand the impact of food insecurity on health risks, both in type 1 and type 2 diabetes. There was a really innovative approach to addressing food insecurity that was selected as one of our abstracts this year, where they used digital health coaches coupled with the delivery of meals to address food insecurity and had really promising results. We also had a number of abstracts that came from large clinical trials that are showcasing findings related to racial and ethnic disparities. And then we had some small qualitative studies that really added to our understanding of disparities in tech use in type 1 diabetes. For the abstracts this year, the words that we used to find the abstracts included things like health disparities, social determinants of health, gender, inequality, health equity. And after we did that search, we were able to identify a body of abstracts that all were addressing health disparities, and then the top 10 were selected. In both type 1 and type 2 diabetes, we know that people from lower socioeconomic status backgrounds have exacerbated risk for morbidity and mortality with this disease. And in type 2 diabetes, we see similar health disparities based on SES. And in type 1 and type 2, we see health disparities based on race and ethnicity that persist independent of SES. So it's essential that we as a field address health disparities in the work that we do, so we know how to target interventions to promote health equity for everyone living with diabetes. When we look at something like the amazing technologies that are being presented here in this very room we're standing in, CGMs and pumps and the advances we've seen in diabetes-related technologies, the advantages of those are not being celebrated by everyone equally. So we know there are disparities in who is utilizing CGM and pumps based on some of those features that I mentioned before, like SES and race and ethnicity, and really being able to maximize the benefit of all of the innovations that are happening. We have to make sure that everyone is able to have access to the technologies and then make meaningful use of them. So addressing health disparities is important to every single aspect of diabetes care, management, clinical trials, really everything we do. There's many abstracts here at the conference that have been amazing to see related to health disparities. We're grateful for the work that's being done across all of the fields represented here at the conference.